Today we will discuss the parts of ophthalmoscope. It basically consists of three major parts. This is handle with rechargeable battery. It contains tungsten bulb, and this is called the collar, or you can also say rheostat around the on and off switch. This green color is on and off switch. Like this collar is used to control or adjust the brightness of this instrument, and this is called the neck, and this whole part is called the head, and this whole side is known as the practitioner side, or you can say examiner side. This is the brow rest, this is the peephole, or you can also say viewing window. This is the dioptric power display. Here you can see different numbers, and moving towards the examiner side, you can see here various filters, but first of all here you can see shutter, and this is the aperture, filter aperture. From this aperture you can adjust apertures. So this central aperture, round aperture, is basically used when the patient's pupil is dilated, and this aperture is used when the patient's pupil is not dilated, and the slit aperture is basically used to see any elevations or on retina or like tumors, and this aperture is called fixation aperture, and it permits easy observation of eccentric fixation without masking the macula. The next one is the red free filter, or you can also say green filter, and here you can, in some ophthalmoscopes, you can also see a green dot, and basically it is used to see the microaneurysms or any vascular anomalies. The next filter, which is not given here or shown here, is the blue or cobalt blue filter that is in blue color, and that filter is basically used to enhance the fluorescein angiography, or it helps to properly see or visualize the corneal staining. And this white color is known as power wheel or disc wheel. You can see aperture, basically it's a power wheel aperture. And whenever you will perform distant direct ophthalmoscopy, you will properly greet your patient, introduce yourself, explain the procedure, take proper consent, and then you will ask your examiner that, sir, I want a semi-dark room, and then you will ask your patient to look at a distant target and kindly move towards the target, and then at a distance of along approximately arm's length, or you can say 25 centimeter, you will perform distant direct ophthalmoscopy, and you will basically observe fundal glow, that is choroidal glow, in normal patients, and but look for any corneal opacities or just lens opacities as well. Then move as close to the patient as possible, and to look and then increase the power from here, from 10D to 13D, to visualize the entire segment, and then decrease the power to visualize the lens vitreous, and to comment upon the disc. While commenting upon the disc, you will mention disc color, cup disc ratio, disc margins, peripapillary region, and vessel contour. At the end, you will ask the patient to kindly look into the light to comment on the macula, or to see any drusions on the macula. And always remember, when you will see the patient's right eye, always hold this instrument in your right hand and observe the patient's right eye with your right eye. It's all about ophthalmoscope. Thank you.